Marina.
Marina.
Marina, M-A-R-I-N-A?
Yeah, like a Marina.
Okay, with UIC.
Yes.
Oh, Marina.
Yeah.
Okay. Hold on one sec.
Go ahead, you're good. Go right ahead.
So, all set, Ed?
Yeah, we're good here.
How did it feel?
It feels good. It feels awesome. I'm just full of hope and light at the end of the tunnel.
As an emergency room physician yourself, what was it like going through and getting the shot and having seen what you've seen and experienced what you've experienced?
Yeah, it was really, I even told the person who gave me the shot, I was like, if I cry, it's not because of you. It's more, it's the heaviness of what this year has represented. And it was really hard not to think about the people that I know that I won't see again. And it was really hard to just, you just have flashes of just situations that you've been in, patients that you've seen, and you wish that this would have happened sooner. But I think this is amazing that we've gotten an effective, safe vaccine in such a short period of time. And it doesn't say that we're out of the woods. We still have to wash our hands and wear our masks and keep physical distancing. But there's an end to it, right? I mean, a month ago we didn't have an end to this. We just had to keep on doing it. And so I'm hoping that when the vaccine becomes more available, that people will volunteer and will be more than happy to step in and get themselves protected.
Do you know how you were selected to be the first?
I think that it was probably a strategic decision to select someone from the Latino population. I am a frontline provider. I work in the emergency department at UIC. Latino physicians are unicorns. There's not many of us. So, and I have been working very diligently with the Latino community to try to spread messaging to protect our community. So I think that all of that kind of led to this seems to be a good representative, and I'm happy to be an ambassador for my community.
It's been about an hour and 15 minutes. Do you feel any kind of pain in your arm? They talk about that.
Nothing. I was just telling one of the other people that it actually hurts less than the flu vaccine. Yeah.
Really?
At the moment, what it feels like tomorrow, I don't know. And a lot of the sort of the immune system response happens 24 hours later. So tomorrow I expect that I might have a sore arm and maybe some fever and body aches. That's okay. I've experienced that with the flu shot, so I'm ready for it. I know what to expect.
You mentioned why you were picked. Why are people in minority communities a little bit more worried or suspicious about the vaccine?
Well, frankly, because historically they've been abused by the healthcare system, right, and by researchers. I think several of the speakers today with Mayor Lightfoot talked about Henrietta Lacks and the Tuskegee experiments, right? In the case of Latinos, Puerto Rican women were sterilized without their knowledge. Recently, we had Latino women in holding facilities that are undocumented having hysterectomies without their knowledge. So there's a reason why minority communities are hesitant, especially when things are happening at a more accelerated pace than they have in the past. But I feel comfortable with the science. I know that the FDA and the CDC have heavily scrutinized the research for these vaccines. I've gotten to see some of the data myself, and I feel confident that this is the right thing to do.
Did you set up your 21-day in advance second shot yet?
No, not yet.
And have you gotten a text from the state? They said that you get a text.
I have to sign up still.
Okay.
But yes, I have all the information. It's in my hands so that I can sign up for the texting program. Yes.
Is there anything else about all of this, being the first, the historic nature, that we don't know to ask you about that's important for people to know?
I hope, and I mentioned this during the press conference too, I think the silver lining in the disaster that has been 2020 in this pandemic is the fact that we're now having more open discussions about social justice and health justice. And I am really proud of the city of Chicago for having selected Loretto as the first place to immunize folks. I think it sends a really powerful message that we are ready to now kind of change the way that we've treated minority communities. And I hope that this is the beginning of a more inclusive process for improving the public health of our city.
Thank you so much for your time. Are you going into work today or no?
No, tomorrow. I took the day off just in case.
And exactly what do you do in the hospital? You're a frontline. You work with.
I'm an emergency physician.
Okay.
Yeah.
Thank you so much.
Emergency room
Thank you so much.
Yeah.
Thank you.